New to the REACH Lab, this is our staff at large. The REACH Lab stands for Research and Education to Empower Adolescents and Young Adults to Choose Health. Stanford REACH Lab includes staff members, researchers, consultants, and the Youth Action Board, which is comprised of high school and college students nationwide who are dedicated to changing the culture of substance use and empowering youth in health and in advocating for policy change. So as we discuss the negative effects of substance use, such as cannabis, fentanyl, or other drugs, we do not shame or judge or hold negative perspectives of individuals who may use these substances, and we acknowledge that stigma is a significant obstacle or barrier in accessing quality health care for people who use drugs. So we want to put this in context when we talk about drug stigma and health equity, and this is why we use the continuum of use. Instead of looking at substance use as a singular or linear type of way of looking at it, we understand that everybody falls on this spectrum, whether of never use to misuse or having a physical dependency, and different substances vary for different people. So some people may drink coffee every day but don't drink alcohol. Some people smoke weed every day but don't smoke cigarettes, and we understand that. So with that being said, we create a person-centered drug education. So we create curricula based on how adolescents learn and make decisions based on factual science. We keep teens safe by empowering them to make informed choices and meeting them where they are. So these are some examples of some of the slides that are in Safety First curriculum. We talk about mental health and self-medication. We talk about how your brain is awesome and we want to safeguard brain development. We have a lot of activities for reflection and developing media literacy, and we also talk about drug adulteration. So Safety First is comprised of 13 lessons on alcohol, fentanyl, opioids, hallucinogens, or psychedelics and other drugs. What Safety First does is see sobriety or no use as an important or primary strategy in reducing drug harms. And the reason why we coin it that way, because we are working with minors, and we need to have parent buy-in, we need to have school administrator buy-in and school district buy-in. But we also empower teens to make healthier choices by providing them with accurate information. We recognize some teens will try drugs, and we encourage teens to take steps to reduce potential harms of drug use. What Safety First does not do is encourage or condone teen drug use, teach teens how to use drugs, or judge teens who may use drugs. So here are some really cool slides that I took some screenshots of that are in Safety First. We have, what I call is that we have core lessons. We have 5 core lessons, some on stimulants, nicotine, cannabis, alcohol, fentanyl, and then we have peripheral lessons that can be coupled with those core lessons. So some of the peripheral lessons would be school drug policy, understanding media literacy, understanding mental health. And then teachers would pair it with a core lesson. So for example, if you're seeing a lot of fentanyl use in your school, but you're also seeing that there's a lot of uptick of mental health conditions, you might pair it with a mental health lesson with a fentanyl lesson. Or if you're noticing that a lot of teens are saying that they're very influenced by media and they don't want to understand the media messaging, we may pair it with a media literacy lesson and cannabis, right? Because there's a lot of messaging in the media around cannabis. We also have lessons on thinking about substances in the way of philosophically, in a way of how teens have misinformation and myths about drugs, and providing more space for class discussion and normalizing drug communication and education. This is a lesson I want to highlight here. It's a very special lesson that we added to Safety First, which is all about stress, coping, and wellness. We want to teach teens how to manage stress and give them tools how to manage stress. And so this is a lesson that was created by the Youth Action Board at Stanford REACH Lab. We worked with them in collaboration. They came up with a lot of great ideas, breathing exercises, what are things that teens may stress about, and what are ways that they can manage stress. So a big shout out to the Youth Action Board. So now I'm going to talk about the goals of this evaluation. So we evaluated Safety First. I have some preliminary data, And so this data is going to describe the reach of Safety First curriculum and determine whether Safety First changes the students' attitudes and knowledge. So Safety First, since it has been released from the Stanford Reach Lab, our team has reached over 300,000 youth, conducted over 57 trainings, and trained nearly 2,000 educators on this curriculum. Our methods is a sample testing of over 8,000 participants of K through 12 across the United States, about 371 students, about 27.6% completed the post survey. So in our curriculum, we have a pre and post survey set up where students can fill out, and this allows the Stanford Reach Lab as well as educators to track the perceptions and knowledge and understanding of the curriculum as they go through the lessons. As granted, they cannot go through all 13 because of teachers' bandwidth, so some teachers might take and teach and take certain lessons that are most impactful to their community. This is not a human subject research study, so we did not need to use IRB to get a review. So this is more like a quality improvement survey. So the variables for this study was the perceptions of drugs and the real and perceived risk of the benefits and knowledge of drug and health effects and intentions to use. And the data analysis shows that the descriptive and independent sample t-test, one-tailed significance determined at p-value 0.5. I'm a content developer, I'm not a researcher. So our preliminary results, this is going to talk about the changes in perceptions. So after the curriculum, students were most likely to agree that the safest path for teens is to avoid drug use, and that young people need strategies to stay safe when encountering drugs. Also, students are most likely to perceive single-use or disposable vaping products as harmful to the environment. Students are also more likely to perceive occasional use of cannabis as harmful to their health, and less likely to agree that it's safe to use Adderall or other prescription stimulants and to stay awake or study. And these are the preliminary results of changes in knowledge. So after completing the curriculum, students were more likely to correctly identify signs of alcohol poisoning, with about 17.2% increase in correct responses from the pre-test or pre-survey to the post-test. After completing the curriculum, students were also less likely to agree that you should let someone sleep it off if in an event of alcohol poisoning. So we're going to talk about some of the limitations here. So some of the limitations are updating the data dashboard, fixing bugs in the data collection, updating the survey questions with appropriate responses scales, ceiling effects. Students' knowledge and perceptions may have good knowledge of the general drug use, right? Non-significant results of perceptions of harm related to daily cannabis use, and educators and students may not have the bandwidth to complete all 13 lessons, so some teachers did not get to the post-survey. So in conclusion, a harm reduction-based curriculum such as Safety First offers a holistic approach to teaching middle and high school students about drugs, about drug use, and engaging in a non-judgmental way. Safety First provides youth with scientifically accurate information to empower them to quit or to reduce harm should they choose to continue to use. Thank you so much. It's an honor. Thank you for listening to me. Stanford Reach Lab aims to expand and enrich our partnerships worldwide to advance global health equity. And you can find me at JTG91 at stanford.edu, or you can find us at Stanford Reach Lab at stanford.edu. Thank you so much.
Thank you, Juanita, and the Stanford Reach Lab. In a world and in a field that's been very dominated for a very long time by strict abstinence messaging and simple conversations, it's pretty cool to see this emerging evidence base and the quite extensive, to use your word, reach that you've managed to gain with that data. So thank you for contributing to the field in such an important way. It's my pleasure to introduce our next speaker, Rebeca. Rebecca Calzada Olvera is a harm reduction advocate and co-founder of La Testeria, the first drug checking program in the center north of Mexico, and also part of the Youth Rise team. Her work focuses on women who use drugs and pleasurable experiences, young people who use drugs, young people who use opioids, young people, and FSHR.
I'm not sure how many people here have the translation thing, because I really wanted to do this presentation in Spanish because I'm from Mexico, and I think it would be fair for me to speak in the first time in Spanish. So if you don't mind, I will do it in Spanish, and if you have questions about it, please let me know. I'm sorry for my voice, first of all. Una disculpa por mi voz, no sé por qué se fue. My voice suddenly go away. So, esta presentación trata de una investigación que hicimos desde Youth Rise. En Youth Rise nos enfocamos mucho en la política de drogas y en la reducción de daños desde la perspectiva de juventudes, que muchas veces es una población que se usa en los discursos para justificar las políticas de drogas, pero no se incluye lo suficiente en la toma de decisiones, en las investigaciones, en otras cosas que es relevante para pues, esta población en específico. Entonces les voy a presentar esta investigación. I will present today this research, Catalyst for Change, Youth-Driven Insights in Opioid Harm Reduction. Esta fue una investigación que se hizo de forma global y en donde con personas jóvenes, usuarias de opioides y reductores del daño, investigamos cuáles eran sus mayores problemas, sus mayores obstáculos, pero también sus necesidades. So this was a international research where with young people who use opioids and harm reduction practitioners, we discussed their main challenges, but also how can we overcome these challenges. So first of all, I'm part of this research. Primero que nada, soy parte de esta investigación, pero no soy la única. 8 personas estuvieron en esta investigación. There were more people involved, obviously. They are collaborators. They didn't participate as participants because we were in what is a true horizontal type of research. The people that were involved in the research decided to put me first. That was an honor for me because I didn't want that, but they pushed for that. That's why my name is there, not because I just said like, yeah, I'm going first. So they decided that was the order. La gente que participó viene de Indonesia, de Portugal, de México, de Indonesia, pero basada en Canadá, de México en Tijuana, de Kenia, de Uganda y de Zimbabue. The people involved there were from Portugal, Indonesia, but based in Canada, Indonesia, from Mexico, but from the border, from Kenya, from Uganda, and from Zimbabwe. El objetivo de esta investigación era entender pues, mucho mejor cuáles son las necesidades y los desafíos de las personas que usan opioides, pero también de aquellos que proveen los servicios de reducción de daños. Porque creo que es importante que entendamos cuáles son los retos de las personas que proveen estos servicios, porque quieren atender a esta población, pero si no entendemos cuáles son sus retos, entonces ¿cómo lo van a poder hacer? ¿Cómo vamos a poder llevar estos temas a las discusiones necesarias? We involved the harm reduction practitioners into this research, because if we don't know what are their challenges to provide the services for young people, then how can we support them into bringing this into discussions that is really needed their input? Y una cosa importante es que nosotros desde Youth Rise promovimos una metodología que en inglés se llama Participatory Action Research. I always forget the A. Y este tipo de metodología lo que busca entonces es que las personas más afectadas estén en todo el proceso de la investigación, desde el diseño hasta la elaboración del reporte. This type of method, the main point of this is that the people that have been most impacted are part of the research from the design until the elaboration of the report. So this is very important for us, and later there will be a discussion about this with my colleague Rebeca Marquez, because we think that us as people who use drugs, we are not just subjects of study. We have so much to say about it. Y así lo que buscábamos entonces era identificar soluciones que sirvieran en sus vidas diarias. What we wanted to do is identify the solutions and provide recommendations that actually work in their context. So over here, you can just see only a few of the people that participated. Beautiful people, amazing people. They're doing an amazing job everywhere. Estas son las personas que participaron. Son personas bellas, personas que están haciendo una gran labor desde sus lugares. Algunas de ellas pues en sitios donde son muy criminalizado el tipo de trabajo que hacen. I already mentioned which type of method we use, and this approach help us to challenge stigma that is very needed, and especially to inform better policies, so we have better public policies that actually address the needs of young people who use opioids. Sorry, my voice is like having a process itself. Y para nosotros este método es muy importante porque justamente lo que queremos es romper con el estigma, tener mejores políticas públicas basadas en las vivencias de las personas que son afectadas y sobre todo que las recomendaciones pues se basen en sus necesidades reales. Sorry, I'm trying to translate at the same time, but maybe I'm forgetting some stuff. So we have weekly discussions for 2 months, and then we identify some key themes. Lo que hicimos fue que tuvimos discusiones semanales por 2 meses e identificamos algunos temas relevantes, and these are the key themes. I won't stop here to read, but these are some quotes from these discussions. You can see the quotes in the report. But the key themes identified were, los temas principales identificados fueron access to safe supply. Of course, they say we don't have a regulated supply, then the risks are super high. And not just that, like young people don't have access to safe supply, if that's the case. So we have a lot of questions there, right? And also about drug checking remains very limited, especially with young people. Entonces las personas mencionaron que a ellos les gustaría tener acceso a las sustancias de forma segura, pero aún así muchas personas jóvenes, sobre todo debajo de 18 años, pues no pueden tener acceso a esto por la barrera legal. Asimismo, el tema del análisis de sustancias todavía es muy limitado. Also, they emphasize the theme of it's not enough decriminalization. We need the legalization and regulation of all drugs. No es suficiente la despenalización, sino que también necesitamos la regulación y la legalización. Also, they discuss about the stigma and discrimination, like how stigma has multiple levels, and we have to address this in different ways. El estigma lo ven en la familia, lo ven en los sistemas de salud, en los sistemas legales. They see this stigma in these areas, and usually it was really interesting to hear them that whenever they're facing stigma, sometimes they have to fit certain narratives so they can have access to certain services. Ellos mencionaron que para evitar el estigma muchas veces tienen que meter y crear unas narrativas que justamente les permitan acceder a los servicios. Also, when we know that people who use drugs, we are very different. I'm Mexican, I'm Afro-Mexican, I'm a woman who uses drugs, and my needs will be very, very different from someone I don't know, from the United States. So identities matter. For that reason, intersectional stigma is an issue that we need to address when we talk about young people. We cannot talk about young people just like a big group. No podemos hablar de las personas jóvenes como un solo grupo. Yo soy mexicana, yo soy afromexicana, uso drogas y mis necesidades no van a ser las mismas que las de una persona de Estados Unidos. Entonces hay que hablar del estigma, pero también a partir de diferentes identidades. Otros temas identificados fueron la falta de servicios adecuados para ellos. Para ellos, generalmente los servicios están enfocados en hombres blancos, usuarios de drogas inyectables. Usually, services are not adequate for young people. These are most like services for males, white males that inject drugs. So we need services that actually are relevant for them. Lack of housing. This is what we mean by full spectrum harm reduction. If people don't have a stable house, it's very hard for them sometimes to access to harm reduction services. Si las personas no tienen casa, muchas veces es difícil que puedan acceder a los servicios de reducción de daños. Porque obviamente si están en la calle, esto implica que tienen mayores riesgos. And trauma and mental health, this was a topic that for me was very surprising, especially when it comes to harm reduction practitioners. So many harm reduction practitioners, they're facing a lot of trauma because they want to provide these services and they have to deal with legal restrictions. If they provide services to people under 18, they might lose their funding. Also, they don't have all the, like a proper salary. Sometimes they have to work in violent context. And also, there's this thing where in this context, they have to see a lot of violence. Estas personas que trabajan en la previsión de reducción de daños hablaron de un tema muy importante y que para mí personalmente fue muy sorpresivo porque hablaban de la salud mental y del trauma que tienen que manejar. Si no tienen financiamiento, no pueden ofrecer los servicios, pero al mismo tiempo, si ofrecen los servicios a personas menores de 18 años, pueden perder ese financiamiento. Es una situación muy desgastante para ellos también porque están en contextos de mucha violencia. Some of them mention how they have seen police brutality. Some of them have mentioned how they saw how their peers died and they couldn't do anything. And some of them, they want to provide these services, for example, to migrants, but they cannot do that because they need to ID people, and migrants sometimes don't have an ID. So I think this is a very interesting topic that should be looked more in depth. Y un siguiente tema fue la falta de servicios de salud y de sistemas de apoyo mutuo. En este tema se habló mucho como de la supervisión que se tiene cuando se les brindan estos servicios. Young people who use opioids mention about the surveillance that they face. So they don't want to seek for these services because it's like, they're an autonomous people and why they should be supervised by an institution. So for them, this was a very, very important topic that should be discussed of. I don't know how much time I have left, so I'll try to hurry. Sorry. Y aquí están las recomendaciones. Primero que nada, necesitamos servicios que no estén fiscalizando la vida de las personas, que sean de apoyo mutuo. We need supportive and non-surveillance services. We don't need police over young people, police in terms of, that could be a healthcare provider or a social worker. Necesitamos educación de drogas, pero necesitamos educación de drogas no como el programa nada más de Stanford, que es muy importante, sino que necesitamos educar a la sociedad en general. ¿Qué son las drogas? ¿Cuáles son los derechos de las personas que usan drogas? Y también tenemos que educarles que hay personas jóvenes que usan drogas. We need to educate society at large, not just young people. We need to educate everyone. We need to make the people understand that there are drugs, there are people who use drugs, and there are young people who use drugs. And also, we need to educate the police, mass media. We need to educate decision makers. We need to educate our communities in general. And this doesn't have to be a confrontative thing. It should be made like as a community, because we're a community. We are in the same society. And another important issue is about opioid and overdose. Very quickly. Sorry. Necesitamos datos, porque con los datos hacemos mejores políticas públicas y mejores intervenciones. We need data because we can create better policies and also services. And wait, sorry, it was here. And I'm just going to stop in the point 6. We need sustainable funding. Everyone here needs sustainable funding, right? So let's chat. Okay, this is the QR for the research. The artwork was done by Jamie Harari, and I recommend you to go to the session of my colleague, that she will be discussing more about the reflections on this research. There are cards there with QRs. Sorry, thank you. Gracias.
Thank you, Rebe. That was awesome. Very inspiring. And those themes are really compelling, and just a testament to what can be uncovered when young people are given spaces and resources and methodologies like participatory action research to have those conversations amongst themselves. Thank you. Encourage you all to check out the report. Lots more to discuss there. But we have a time crunch, unfortunately, and lots to get through. And I'm very excited to introduce our third speaker, Russell Turner. Whose bio I don't have. I'm so sorry, Russell. That's my bad. We've changed up speakers, but I'll let Russell introduce himself. He's from the University of Gothenburg.
Yes, thank you, Nick. Yes, so Russell Turner, I'm an associate professor at the University of Gothenburg. Some of you might have been expecting to hear Damon Barrett. He is actually here. And so Damon, I, and Frida have worked on 3 studies over the past 3 to 4 years, which I'm going to be talking about today, on the topic of under 18s who inject. So many people who inject drugs report having begun before the age of 18 while still legally children. Thank you. Yeah, so while they're still legally children, even though they might not identify themselves as such in terms of the law and policy, they are. So my main point of this presentation is that the legal age of 18 is perhaps one of the most important variables in law and policy for this age group. It changes the risk environment in terms of harm reduction, and it's important for the concept of low thresholds. So the 3 studies I am going to be talking about, it's important to bear in mind, they are 3 high-income European countries. So I'm going to be coming back to this point. And yes, so lots to get through. So I'm only going to be touching briefly on the outline, the background of the studies and the methodology, and get into the results as quickly as I can, and do all this in 10 minutes. So, what's the issue? There's a lot of research on young people who inject drugs, and studies often talk about youth, or use terms of concept of adolescence, and it muddies the water sometimes in terms of this legal definition of the age of 18. And there's no kind of common language to look at. Does it matter if you begin injecting as a legal minor? So no real population estimates of people who begin injecting as a legal minor, begin injecting before they turn 18. So we thought this group is often invisible in research. They're often invisible when we look at policy in a Western context. They're invisible in policy, possibly invisible in practice too. So our research project has some pretty basic questions to begin with. We were interested in things like how many, what kind of population estimates, how many people begin injecting as a legal minor? At what age does this begin? In which context? What factors influence early injecting? But also, what kind of support needs do people themselves report? What barriers in accessing support do you have as someone who begins injecting before you turn 18? And how might this align with child rights and concepts of the best interest of the child? So how does law and policy help or hinder access to care and support? So where did we do this study? 3 high-income European countries, Sweden, Switzerland, and Wales, have very similar drugs legislation, a prohibitionist model, more or less. In terms of harm reduction, they differ slightly. Sweden has been famously anti-harm reduction. Switzerland is much more progressive. Wales has more of a public health approach to harm reduction. We use a mixed methods approach, so we gathered in registered data from a bunch of different national databases of drug treatment, needle exchanges in all 3 countries, so Sweden, Switzerland, and Wales, to see what we could learn from the data. Interviews with people who began injecting before 18, and we did focus groups with professionals who either meet or would meet this group. So social workers, harm reduction workers, youth drug workers. And we looked at this through our data, analysed this through the lens of risk environments, which you might be familiar with, the concept of low thresholds, and the best interest of the child. So I want to get more into the results. As I said, Damon are here afterwards, so they will talk more about methodological research issues afterwards. What do we find? Across all 3 countries, we found between 22 and 29% of all adult injectors began before they turned 18. So the idea that young injectors, people who inject as legal minors, is this hidden group. At any one time, any group of adult injectors, 1/5 to 1/3 of people began before they turned 18. You might say, does this matter? I'm going to come on to that question in a moment. Just to get the size, this group exists and often invisible in research, policy, and practice. This is the data from Sweden, age date of injection debut. The red line is the age of 18. So you see, and when you look at those that began injecting before 18, the average age was 16.5. So you have a very short window of opportunity for harm reduction, for care, support. In a year and a half, these people transition it into adult services, and you might essentially lose them, or you've missed a window of opportunity. From the interviews, I want to share a few insights from some of the things that we found. Conditions of debut is quite well researched. It wasn't a major focus of what we looked at. And some of the things we found confirm harm reduction research going back to the 90s from other countries. But common stories and some divergent stories. So stories of childhood adversity, mental health issues, unstable housing. But some opposite or divergent cases in this. People choosing to inject as a way of self-medicating. They weren't getting access to the psychiatric care they felt they needed. In terms of drug education, one of the themes of this panel, so how did people learn to inject? This has important implications for harm reduction messages and strategies. Learning from older romantic partners, often a lack of safe guidance. There were attempts to inject safely, some knowledge of harm reduction, even at a very young age. But this knowledge of safe injecting practices limited by who you rely on for your advice. And again, this has implications for how you might reach this group. But alongside these stories of childhood trauma, which are quite familiar, and mental health, we also saw stories of agency, curiosity, spontaneity, some people just being intrigued by this. And again, the story of self-medication. So kind of thought that there's no one size fits all. There's no one single story here. even though common themes. So to the kind of key question, does it matter if you begin injecting before 18 in a Western context? Being 18 in law and policy is decisive. In terms of development, psychological development, it's an arbitrary number. Development goes on beyond 18. So we compared people who began injecting before 18 with the groups who began injecting a bit later. And we found some key differences. So it does matter on some things. Longer delay in accessing services. This might seem obvious, but when we compared to people who began injecting just after 18, a younger group of young adult injectors, we saw that those that began injecting younger took a lot longer to get in contact with harm reduction services, which we think might increase to health risks. What I mean by this is, with this diagram here, the blue-grey bars are those that began injecting before 18, and the orange bars are those that began injecting afterwards. So you see some differences. These are all statistically significant differences. Not huge, but they are there. So you have higher rates of daily injecting or higher if you begin before you're 18. Higher rates of using non-sterile equipment. Higher rates of hepatitis C. So increasing health risks if you begin before you're 18. Why this might be, I'm going to come on to accessing care in a moment. But the longer delay in accessing services we thought was really important. In a Swedish context, if you begin injecting before you're 18, you're subject to much greater use of compulsory measures. Arrest by the police, put into secure care, which is like basically a mini prison for youth. And despite this excessive use of compulsory measures, we saw no better health outcomes later on in life. So why this delay in accessing care and services? From the interviews, both with people themselves who began injecting before 18 and staff, focus groups with professionals, we saw both there are, in some cases, legal restrictions. In some cases, you literally cannot access harm reduction services before 18. Other countries, in Wales and Switzerland, you could. But despite this, both young people and professionals were sometimes unclear about this, a lack of clear protocols. And what happens when you're unclear, both as a professional or as a young person, but particularly in the case of professionals meeting this group, that you rely on this kind of default position. What do we normally do? In Sweden, we normally send people into coercive care. In Switzerland, we focus on safer injecting. In Wales, more of a public health model, looking at housing and family issues. So the devil is in the default. A fear of detection, discovery and stigma for young people. Even where harm reduction services were available, there was still a fear of being discovered by parents and friends, a shame in going and seeking out help and support. But this is against the background of particularly in Wales and Sweden, there's a duty to report by social workers. So a real fear of I might get locked up if I go and seek support. Also, the adult models of harm reduction tend to dominate existing services. So young people talked about low threshold services being too adult-like or full of adults and being unappealing in their situation. And again, I'm going to come back to what this might mean for what youth-friendly harm reduction services might look like for young people who inject. So I'm going to talk briefly, 2 more slides. Topic of harm reduction for young people, which is the subject of this panel, has come up at this conference a number of times over the years. We wrote a short paper, I think some of you might even be here in the audience, who contributed to this commentary paper on child-centered harm reduction, trying to cover some of these very difficult legal, ethical, and practical issues about how to deal with this hidden population of young people who inject. The age 18 is this kind of key variable for policy, practice, and research. That in a Western context, it really matters. Recognizing that minors, legal minors who use drugs, they do so as children in a legal and research terms. A young 17-year-old turning up at a needle exchange, we might not think of that as a childlike behavior. That person wouldn't see themselves as a child, but in terms of law and policy, they are. So differential access to services, being subject to differential compulsory measures as a child or an adult, different duties and different human child rights, either exit or enter, depending on which side of the 18 line you fall. We talked about adapting services to child rights, but also to developmental needs. That someone's development doesn't stop at 18 either. And the transition to adult services you can lose certain kind of, you might gain more voice as an adult, you might lose certain access to what you might need developmentally. But we're also questioning, we're fairly sort of cautious around what adult-orientated low-threshold services, whether that's appropriate for kids of this age. And so linking to that, some the policy and practice implication we can draw from the interviews we did and from our analyses. What might drugs education look like for this group? We think to reevaluate age-based restrictions. This needs to be again done fairly, I think, quite carefully, thinking about not just simply lifting up adult harm reduction services and saying that we can apply this to young people, but thinking through what might age-adapted services look like. And just to reiterate here again, these suggestions come from 3 high-income countries. It may not be relevant to other parts of the world. So, in terms of developing youth-specific services and protocols, we see a need for improved clarity for staff. When staff are unsure what to do when they're meeting this age group, then the tendency to fall back on how we normally do things might not be appropriate. But then what should they do? And having clarity for professionals. But we know from young people who could have accessed services didn't for a number of reasons. So how might we improve outreach? How might we make services more accessible for someone who has begun injecting at a young age? What might an age-adapted service look like for someone in this situation? And finally, injecting is a apex question for harm reduction research. If you can't solve that for this group who begin injecting before 18, then it makes it more difficult to solve other issues of youth drug use. And we think that the age 18 is a really important variable for harm reduction, both policy, research, and practice for young injectors. So thank you very much.
Thank you, Russell. That was fascinating. As I said before as well, it's awesome to see more empirical research coming out in this space, especially from a harm reduction perspective, and adding to the conversation with such interesting data. So thank you. One thing that really stuck out for me there is the variability in terms of the kind of access to, I guess, like the organic harm reduction practices that these populations might have access to very in relation to who they're using with and who they have access to use with. And obviously those, I'm sure we can all understand, those settings are subject to quite extreme levels of stigma and discrimination. And what came to mind for me there as well was Rebeca's point earlier about comprehensive drug education for all of society, including the need to destigmatize across the world. So I encourage you to think like that as we move towards discussion later. And we have been told we are going to be able to go 15 minutes over time today. So yeah, I'm looking forward to a rich discussion. But let's keep hearing from our awesome speakers. I'm very pleased to introduce our 4th speaker, Ruby from YouthRise. One second, I'm so sorry. Okay. Ruby Lawlor is an experienced strategic drug policy reform and harm reduction advocate, from grassroots to the high-level advocacy. Ruby's been involved in YouthRise since 2020, and as the International Communications and Advocacy Officer, and assumed the position of Executive Director in May 2022. Looking forward to hearing about your project, Ruby.
Hi, everyone. Let me just get this mic right. Can you all hear me good? Yeah? Amazing. Okay, so thanks so much, Nick, for the introduction, and it's an honor to be on this panel with everyone here. It's been really cool to hear about the Reach Lab. It's great to hear Rebeca explain our projects, and then also about the youth-friendly harm reduction and under 18. So I'm kind of taking the panel in a bit of a different direction. It's more so on how to strengthen and support youth-led organizations in this space. So I'll be presenting this on behalf of Youth Rise, my organization, but also Students for Sensible Drug Policy International, and Joanna Banga, it's a Lithuanian word, I might be butchering that, or Young Wave in English. So we conducted a project from 2023 until 2024 called Youth in Power, and it was based on building and sustaining the next generation of drug policy harm reduction activists. And I'm going to explain a bit about that, but it's not very applicable to many people. There's very few youth-led drug policy reform and harm reduction organizations. So a lot of the lessons that came from this project might not apply, but what we're going to do is try to help you guys understand as adults how to best support young people in this field. So as just an introduction of our organizations, Youth Rise is a global network of young people with lived and living experience of drug use, as well as those impacted by punitive drug policies. We empower young people to engage meaningfully in harm reduction and drug policy reform, advocating for health, human rights, and policies that reflect our realities. Our work centers around representation and meaningful engagement of young people in decision-making bodies at international, regional, and national levels, production of youth-led research, like Rebeca explained earlier, policy briefs, educational material, and capacity building. We do promotion of youth-friendly harm reduction, so it was really cool to hear more about that from the academic side, and drug policy reform that actually centers young people. Our work is conducted in close collaboration with our international working group, which is a group of young people who use drugs and young experts in drug policy and harm reduction. SSDP International is the largest grassroots network of students and young people advocating for sensible drug policies. With chapters in various countries, they work to empower young leaders to engage in drug policy reform and advocacy by campaigning for evidence-based policies at national and international levels, promoting harm reduction and public health through equipping young people with knowledge and resources to reduce drug-related harm, and ensuring global networking and solidarity by connecting chapters and activists across regions to share knowledge and best practices and building the next generation of policy advocates and movement leaders. And finally, Young Wave is a non-governmental organization founded by young people following scientific progress in drug policy issues and striving to ensure access to high-quality science-based information about psychoactive substances. The idea of this organization and its activities was founded in 2016 when, for the first time in Lithuania, a team of 4 young people implemented harm reduction services at a conference or at a music festival. And over the years, Young Wave has grown, strengthened, and today it is already implementing not only harm reduction services at events, but also civic actions, discussions, trainings, creating videos, and other products on drug policy and harm reduction issues. I wanted to share the details of our organizations, as there's not many people who know that there's people out there doing youth-led drug policy reform and harm reduction, so I want to make sure that our organizations are highlighted well. Next slide. So this project that we did was based on the fact that youth-led organizations in drug policy reform and harm reduction, but in general as well, can often suffer from a range of capacity issues. And the key issues we identified for this project was poor leadership transitions, which can often happen due to burnout or young people voluntarily doing stuff and then maybe having to transition to a paid role, having to drop out of the space, and then not having the leadership transition process for someone else to come back in. So that's happened in the past. Poor institutional knowledge and memory, so that kind of ties in with the leadership transition, maybe not having that documentation of what was done years ago. I still don't exactly know what Youth Rise did 20 years ago when it was founded, and maybe through the years there's gaps in my knowledge still, but we've done a lot to try to document since. And a lack of long-term strategy. It can be hard to strategize for the long term when you're so immediately faced with lack of funding, working on voluntarily hours, which shouldn't be the case. So this was something else that was identified. And then another thing which applies more to all of you today is that there is often a lack of a clear strategy for non-youth organizations to meaningfully engage with us. So the project objectives are pretty understandable based on the project rationale I just gave. So in the interest of time, I'll move through this. It's basically addressing everything that was based on the rationale. So the process itself, we basically did a needs assessment and an organizational analysis. we created a tool called the Organizational Assessment Tool, or OAT, which is applicable to our harm reduction terminology. And this evaluated the capacity of the organizations in the project in regards to the governance, the organizational management, project management, human resources, all the boring stuff of this work. The tool also served as a roadmap for improvement, and it provided valuable and measurable insights to our organizations and allowed us to compare our strengths, share best practices, prioritize efforts, and set realistic goals. Building on these insights, we then conducted a series of consultations and workshops aimed at sharing best practices and strategies for leadership transition, institutional memory, and strategic planning. And these were conducted with previous executive directors, those we could still find, founders, and long-standing members of the organizations, as well as key people from other organizations who've worked with us maybe from our inception over the years. And in the next phase, we worked on developing a sustainability framework and a framework implementation plan. We did more workshops, drafting sessions. We all met in person in Dublin, which is where that photo is from. And then we validated the framework there. So our OAT, we have two versions of the same one. We have this one, which is on youth drug policy and harm reduction specific metrics. And then we have one, which is all the financial, governance, the kind of basic things all the organizations need to look at for sustainability. But I'm highlighting here only the one that was on youth, because I think this is key for the adults to look at their organizations and see whether this is something that they are achieving, if there's interest to work with young people, some metrics to be able to figure out how to do that, and then to build on that with strategies as a result. We have the OAT, we have all of the products that came from this project are on the website, YouthRise's website and the others, but I will just note that the QR code for the OAT, this tool, is not up to date. And I discovered it this morning when trying to click on it. So I'm very sorry about the timing of that, but I will upload it to our website. And yeah, hopefully then you could access it. So that was an unfortunate timing, but it is an open access tool that anyone can use. So the outputs were these 3 outcome documents that can be utilized, adapted, and improved upon by the youth-led organizations in this space, other youth-led organizations that face similar issues, drug policy and harm reduction organizations that want to engage with youth-led organizations. And these 3 outputs were the youth-focused OAT, Organizational Assessment Tool, Flexible Implementation Handbook, a Sustainability Framework, and a results report as well. So some cool outcomes for us. For YouthRise, we created a new structure for the management team or secretariat. We created 2 departments, finance admin, program department, created 3 programs that allowed for us to have more strategic alignment of our activities and not do activities based on a donor telling us that that's what they want us to do. We have our programs and our activities, and people can fund the work under them. And it allowed for more easier leadership transitions. In times when I had a burnout last year, I was able to step away for a month and the team could keep going. There was an understanding of the roles and how they all play with each other, and it really created, I think, for the first time, a team within the organization instead of people working individually for certain donor projects or whatever. We developed a new organizational strategic plan, actually still in the process of validating it right now. It's been chaotic to get it ready in time for this conference. And we also, as part of that, had lots of conversations with those who've known of YouthRise for a long time and were able to give us some guidance on what we did in the past, what was best for us not to leave behind, because we have to adapt to the new world we're living in under the big T, bad T word. But trying to make sure we don't lose core parts of us as well. We developed some boring things, policies, protocols, templates for internal reporting. All of this were successes of this project and things we identified as gaps. And something that I think is key that all of our organizations do and that we really want to activate you all to do as well is to work with us on youth topics and try to figure out how you can advance the young people in drug policy and harm reduction advocacy efforts within your own organizations. Through using that tool, but also through learning through us what it is that our needs and priorities are, how we advocate for them and how you can partner with us as well. Because the main thing that the war on drugs keeps saying is to keep young people safe. It's the like hailing call of the whole war. And it's what's continuously said. And as I see us advancing drug policy efforts and making some ways forward, I think the one thing that will always be somewhat unanswerable by people, except for maybe our organizations that are youth-led, is what about young people? You can put forward all of these reforms, you can say they're all evidence-based, they are, you can see why it's important, but then they go, what about young people? And we're here to help answer that question, and that can hopefully bring us even further in our policy reform efforts. For SSDP International, there was some great achievements as well. The project strengthened their institutional memory. From not having any policies or protocols, they now have these in place, and this has helped them to compete with larger organizations for funding, whereas they weren't able to do that in the past, and even leading a consortium to apply for funding, which was a huge step. They've also developed strategic plans and work plans, have concurrent projects that they're leading on, strengthened financial infrastructure mechanisms, sustainable funding, and strengthened relationships with key departments, and they're now seen as key experts. Young Wave also had some fantastic results. The Youth Empower project gave representatives of Young Wave the space to reflect on how leadership in grassroots youth movements can be sustainable without burning out, something that's very unusual in it, or something that is very usual, burning out within harm reduction activism, and trying to look at this from a youth perspective. Young Wave's growth and work across the Baltics in recent years was also significant, and the project helped them to capture and extract lessons from the experience. The project also supported them in documenting processes and setting up tools to carry forward not just names, but knowledge and intent. And during the project, they explored what sustainability could look like for a relatively small youth-led harm reduction NGO in Lithuania, and how their mission fits into wider shifts in the region. While exchanging lessons learned with YouthRise and SSDP International, they finally reframed and confirmed both short and long-term organizational strategic goals. So that brings me to the end of the presentation, but not the end of the conversation. So we have some context here for the three organizations. And we ask that you work with us, learn from us as we can learn from you. And continue the advocacy efforts without leaving behind young people. Thank you.
Wow. Thank you, Ruby. That was an epic presentation, and thank you for shining a light on the issues that youth-led organizations face. Not only in this space, I'm sure, but particularly in this space, noting the Halian call of the war on drugs, as you said, and how the rhetoric often boils down to how do we keep the children safe. But the systems and the processes at every level are built to silence those voices. So this work is fundamentally important. Having been a part of the global youth movement for several years, about 8 or 9, I've seen a lot of this revolving door of capacities and changes and operating and producing epic outcomes in quite a generally not the most supportive environment, but it's so inspiring to see step by step, generation by generation, you guys do more work to progress that and to improve this environment for young people. So thank you. All right, we're going to continue the conversation before we move to audience discussion. And I'm very excited to bring in our last speaker. Jade Creelman is a youth advocate from Saskatchewan, Canada, with a specialization in accessible youth harm reduction, particularly for youth that are considered hard to reach. Their work has involved organizing systems for youth to access harm reduction within the same spaces they access art and cultural programming. Thank you, Jade.
Hi, everyone. Everybody else is like super cool and has like academicness. I'm just a frontline worker. I just have lived experience. I appreciate y'all. So Hello, my name is Jade. I'm a 5th-generation Ukrainian settler from Treaty 6 territory in Canada. My maternal side fled Lviv in World War I. And I begin with a short story about my identity, the way that my Indigenous friends back home do, because I learned that stories are a great way to build trust and a great way to build rapport with people. And it's a good way of showing respect. In my years working with these friends, I earned a lot of trust and a lot of stories. The reciprocal relationships I had with the youth would come to earn stories that would save lives. Thank you. And I will explain this some more, but first I will share a little bit more of my story with you, just because that's the basis of my work. So that's me as a little baby. As I said, my name is Jade. I turn 23 next month, and I'm from so-called Saskatoon, Saskatchewan, Canada. I've lived everywhere in the prairies, though, as both my parents used drugs, my mom using uppers, and my dad using down, and things weren't exactly stable for any period of time. I've been a youth leader since the birth of my sister in 2008, taking on a caregiver role at the age of 6, extending to my little brother as well, who was born in 2010. I would often cook and clean, I would put them to bed and bathe them, effectively doing everything required for care aside from legal things like doctors. Because of this, both kids act just like me, and it's terrifying to see. Once things settled and I moved to Saskatchewan in 2012, I began to yearn for more leadership opportunities. My family had been in scouting for longer than my grandfather's been alive, so naturally that was the first choice that I made, was to join scouting. Once in scouting, I became a patrol leader, taking responsibility for leading a group of 6 youth my age. I did things like organize camps before prepare programming, and offer support in the form of listening. In the year 2016, my mental health took a turn for the worse, and my parents began their divorce process. In 2018, I decided to start an art collective with my friends. Most of my contributions were just ideas, as I still did not have capacity to lead again yet. That would come in 2020. The year that my father died to a fentanyl overdose. Due to this loss, along with the 76 youth-related fentanyl poisonings in 2021, this includes ages 0 to 29. That's important for me to note, because I consider youth to be up to the age of 29. Sorry if my voice is, I'm just really excited. So I decided it was just time to step up and provide support in the only way I knew how, which was listening. I ran programming titled Community is Harm Reduction. There we go. From the pilot project in late 2020 to till burnout got the best of me in 2024. Each year had a different topic relating to what was pertinent in the community, though through the youth size, including my own, as often I forget I am still a youth. Year 1, we did a pilot project called The Blank Book with my coworker, Kiari McNabb, assisting in the prep planning. We contacted an ethics professional to help come up with questions to ask and methods to use to ensure that we were keeping everyone possible safe. From this, we created a small zine publication, which is available online. I forgot to put the QR code, but hit up my Instagram, you'll see it. After this came 2021, was the year I saw the most overdoses, the most macings, the most violence. This year, we decided to once again do a blank book entitled Opioids and Overdose for youth to tell their stories in an anonymous yet identity-rich way. I'll explain that in a bit. And because of the violence we were seeing, the final year that I ran was entitled Rocky Relations, with a focus on healthier relationships, with a highlight on sexual health. We saw youth get neurosyphilis and go into psychosis, so we needed to act. All of this work landed me at Harm Reduction International 23 in Melbourne, where I presented on my opioid programming. Someone in the crowd decided they liked my work without me knowing, and months later I got an email from my favorite podcast, Crackdown. Crackdown is a podcast run by some of the members of Vandu, some academics from UBC, or University of British Columbia and Yale University, and of course, drug users. It's an inside glimpse of what the war on drugs is doing to our friends, our family, at home in Canada. The host, Garth Mullins, is my hero, and I was so excited to meet him. He is a longtime injection drug user with albinism affecting his vision, and yet he makes the most beautiful art to share with the community through the mediums of music and podcast. He focuses on humanizing the stories of people who use drugs, building real relationships with them. And I am sure anyone in the room who has interacted with Garth can vouch for how much humility and compassion he holds in his heart. While he holds compassion, he also holds passion for changing policies to ensure that our fellow people who use drugs can perhaps one day live a liberated life where their existence isn't illegal. Always forgetting the slides. The goals of my programming were simple in a complicated way, with each year having 8 to 14 deliverables to be completed alongside running a youth center with the average of 7 total staff members. I had input on what my goals would be, but each year we made the goals more and more complicated and less attainable for myself. I find this to be the biggest error and the biggest factor to my burnout. I think I would still be in harm reduction if I had more input on what my programming was. And yeah, it was just hard as someone with moderate to severe mental health needs and chronic health issues. So my biggest goal each year was just to complete the Blank Book project. And the Blank Book project is and was a community publication based around submissions, with each submission earning the youth $50 Canadian in cash rather than a gift card, as we believed that people have the right to use their money as they please. We still believe that. I just am not a part of that organization anymore. We spoke to the youth and read through the questions with them and met any accessibility needs we had to. We offered the option for verbal statements that I would later transcribe for those who preferred verbal storytelling, as it is integral when working with Indigenous people that you keep their oral traditions and barriers they may be facing as a result of colonialism in mind. We had a lot of art submissions, adding some lightness to a heavy publication, and we had plenty of stories in the form of rap lyrics, poetry, and letters. I additionally brought the idea forward that we should have naloxone on site as overdose numbers rose. Naturally, unused supply distribution funded by the province came next. And finally, to tie it all together, I would hold educational harm reduction sessions where youth could ask questions and watch interactive presentations where they would either retain information or we would discover new gaps to talk about because the current topic wasn't relevant. I tried to remain unattached to outcomes, and I think that's a key, something to keep in mind when you're working with youth, is they aren't always going to do what you plan. All right. The major goal for myself was to bridge gaps between youth and the medical and housing services offered in my city, as I was seeing too many youth sleep on the street out of fear of sleeping in a shelter, and I was patching up too deep of wounds for myself as a first aider to be comfortable. Because of this, I began a partnership with MetaV, who runs our community paramedicine program, and had paramedics come in periodically to build relationships and provide needed medical care. As well, I began hosting sexually transmitted bloodborne infection clinics with our health region in order to ensure the youth knew their status and could act accordingly in order to keep themselves and others safe. This was incredibly important to me after seeing how many of these youth were having unprotected sex without regard for the possible consequences. And we had a case of neurosyphilis in 2022 and 2023, and that was scary. As far as planning went, I keep forgetting the slides. As far as planning went, I tried to include the youth as much as I had capacity for while ensuring I was meeting my deliverables in a timely manner. I began doing periodic surveys to assess the work that I was doing, often with progress being made in their knowledge, though I always gained more from the surveys that said that I was lacking, because then I know where my gaps are, then I know how to address those gaps. And it would help us meet their needs. So while trying to meet these needs, we would often have informal discussions, which I found to be the most insightful discussions, with the least amount of qualitative data, unfortunately. So you gain one, you lose the other, but it's all important. These discussions were integral to the development of workshops and educational materials. We built real relationships with these discussions, with youth slowly coming out of their shells and bringing forward more and more personal stories, giving us a glimpse into what it looked like to be a youth in inner city Saskatoon. These relationships helped us identify support needs such as hygiene supplies, dietary needs, and mental health supports, such as the trauma therapist we had come in weekly on site to have appointments with our youth for free. If anything, the biggest mistake I had made was relying on myself too much. I should have been relying on the youth more. And I think everybody should be relying on the youth more. In saying that, though, oh no, I have more slides before this part of the script. This is all freehand now. So for the execution, I was given 1 day a week to do my programming from 3 p.m. to 9 p.m. I would cook a meal prior to the session to ensure that everybody had a full belly, because people focus easier when they have a full belly. I would have regular check-ins, formal and informal, so I had like sheets that they could fill out at like the gathering, and then I also would just talk to them. And I would remain unattached to outcomes, because once again, youth don't always do what you want them to do. And of course, following the lead of the youth participants. If I'm talking about opioids and they want to talk about sexual health, we're talking about sexual health. It's their show, you know? They're the ones that are going to be taking over for us. So I say us, I'm still 22. And as a result, because of the burnout, I was unable to see the result of my work at the time. I felt like it was fruitless. I felt like I wasn't contributing anything. But when I was looking at the stats, 2022, the year that I ran opioid and overdose programming, there were 50% fewer AFAB and 16% fewer AMAB youth deaths caused by fentanyl, which I think is crazy. And that's in all of Saskatchewan. That's not just my city. I'm just so proud of them. And the youth relationships built with services they'd otherwise refuse. There's this one youth who is my little buddy. They called me one day in psychosis, so I drove them around a bit. And I took them to the hospital, because I was like, it's either a hospital or like a shelter, dude. Like, I'm not paid for this. And it's not the money, it's just the capacity, you know? So I dropped him off at the hospital, and a few days later, at the shelter. And this guy refused to go to shelters. Like, absolutely vehemently hated the idea of sleeping in a shelter. So, like, the work that they're doing with support is amazing. They're making huge change for themselves. And there was a minimum of 3 lives directly saved by staff of Chokecherry, which is the organization I was with, Chokecherry Studios. That's through naloxone administration, and 3 is a big number just because it wasn't a safe consumption site, it was an art studio. As well, my programming is still continued. Lasting programming extending into healthy relationships, sexual wellness, and how to adult, run by current program coordinator, Connor Rodriguez. My goodness. And in conclusion, youth voices are to be included at every table. In the same breath, youth must be given the tools to succeed. Youth need transparency about the work that they're going to be doing and should be given proper training on burnout, compassion fatigue, and stress management. I found that after the 3 years I worked for this organization, I was so burnt out and physically ill that I had to take a full year off of working, which put me back in poverty. So we're back at square one. So we need to be equipping youth. Need to. And yeah, the lack of transparency. I started working at an art studio, and just because I wanted naloxone on site, everything escalated to a point where I was unable to manage all the vicarious trauma, which I learned about in year 2 of my employment, vicarious trauma. I don't know, it just should be sooner. And yeah, as a person with chronic illness and lived experience, it was hard, but it was very worth it, and I'm excited to get back into the community. And I'll end with the statement, including youth without transparency and training is just as bad as not including them. It is harm induction. And that's my Instagram if you want it.
Some pretty hard acts to follow. Can I have a round of applause for the panel? Yeah. Thank you, Jade, for your work in your community, for bringing it to the global stage, for inspiring us all, for showing us how like art and care and friendship and just driving around together and looking for services is what this work is, you know, at the end of the day at the local level. Thank you for reminding us of that, and as we go into discussion, making sure that the conversation is grounded in that, you know, it's where we need to be. Okay, we've got about 25 minutes for questions and discussion, which I'm very looking forward to. So please have a think. And I'm also just gonna take a second to organize a roving mic situation, but also just give us all 30 seconds, a minute to just take a breath, our panel too. We've covered a lot today, guys. We've got schools, we've got young people who use opioids, we've got young people who inject, we've got research, we've got youth voice and participatory action research, we've got high-level advocacy at the UN, we've got global organizational capacity issues, and we've got local leaders saving lives on the ground. So there's a lot to talk about. And yeah, I'm really looking forward to your questions. Let's just have a breather for a moment, and I'll be back shortly.
Hi, I'm Azza. I'm from the US.
I was putting you forward to be volunteer for roving mic. Okay, good. Sorry, it wasn't on when I said that. Sorry. Thank you. Now you get the first question.
Oh, wow. Thank you. Wow. Beautiful. I love that. Hi, I'm Azza. I'm from the United States. I was originally born in Canada. I was wondering, I don't know who to direct this question to, so anyone who feels compelled, but are we good? I was a activist in college, and I feel like there's a lot of young activists in college. It's a really big space for progressive activism and leftism, and so a big thing that I'm interested in is how can we make young people who are already interested in progressive policies understand harm reduction as part of that intersectionality, because a lot of those spaces talk about the intersection of housing access, the intersection of social justice, criminal justice, racism, gender equality. There's a huge, I think, potential there in those spaces. So I guess broadly, I'm interested in how we think we can bring harm reduction into the education that's happening in the education activism spaces. So whether that's high school activism or college activism. So thank you.
Okay. I want to first say thank you for your question. I think it's important trying to find ways to include youth in bridging that gap between academia and youth leadership. What we've done at Stanford Reach Lab is creating youth action boards. So providing a platform for young people to engage and create initiatives that are important to them, and leading that way and allowing us to learn with them understanding that they have voices and they have many different backgrounds and their journey is different and they want to speak to their story. So with the Stanford Reach Lab, we have young people who are interested in research or content development or even translating comprehensive drug education into other languages. So I work with a lot of young people who translate. We're working on actually translating Safety First into Spanish and also having it in a college app form. And that's also leading by young people. So having peer-to-peer education too. So turning our curriculums, not just adult-led, but also youth-led educational resources. So that's something that I would recommend.
My recommendation is collaboration with other communities. In where I work in Mexico as a harm reductionist, what we do is we train what we know, because we don't know everything, and we share with other communities. For example, young women who use methamphetamine. And what we do sometimes is that we set up places for them to discuss and bring harm reduction strategies that do not need resources, but just to put them in a discussion and elaborate them in a way that can be shared is very important. And also about the intersectionality, we created a full spectrum harm reduction report, bringing the practices from different parts of the world. And it's very important to acknowledge what's the main harm when we discuss about drug issues. And I think that's very important. First, to acknowledge the context. The context impacts a lot in our well-being, but also our identities. So I think that's why it's very important to collaborate with other communities. That's my advice.
Yeah, it's a great question, and it's kind of funny being here and researching on youth drug use as the old person on the panel. So yeah, I can't speak to what youth should do. I think things being youth-led as a teacher, I think it's really important for me to teach the students that I meet about harm reduction, and it's kind of the small contribution, but I'm really inspired by seeing a lot of the youth-led initiatives. I kind of think, wow, I just need to let them do it. They know what they're doing, and it's so wonderful to see some of the different presentations I've seen here at the conference and the exhibitions downstairs on youth voices on harm reduction. So I think there's loads of amazing things going on. I'm going to pass the microphone so someone can speak more to this, I think, than I can.
I think I would start just by talking to younger youth and seeing what they know, and building up from that baseline knowledge, and then having the youth leadership piece, as previously stated, is incredibly important, because I know for myself personally, I learned a lot more from peer education than I did from school. So doing the research yourself, and it's a lot of work to take on, but it's important work, and kudos to you if you have the capacity to do that. But yeah, just youth-led, peer-led education.
Thanks so much. It was an amazing panel. My name is Matt. I'm from Vancouver, Canada. I'm friends with Danny and Jade. I was going to come find you later, but my question is mostly for Jade, but also the rest of the panel. I think I was so appreciative that we are so focused on the importance of amplifying youth voices and having youth be not just at the table, but leading the table. But also, Jade, the fact that you brought up the risk of burnout and that idea of if youth aren't properly supported, we can quickly shift from this being a harm reduction practice to a harm induction practice. I love that framing. So I'm just wondering if maybe you could share, and potentially some other youth voices, what you think is needed to kind of adequately support youth to be leaders and to be sitting at the tables in these spaces, be that, what types of supports, compensation, et cetera, models do you think are going to actually allow youth to do this work without burning out and without being, victims of the very structures they're trying to resist?
Yeah. Okay. First of all, I didn't have benefits at my job, so give youth benefits, please. We need therapy. So I think just including stress management at every key point and having, like, if there is an event, if there is a crisis, there needs to be action immediately after that to, like, help heal. And you need to be able to do it together. It can't be, like, just me in my room very sad that someone almost died today. It has to be us very sad, you know? Because when you have togetherness, there's less of that, like, empty, lonely, cold feeling. And even if it's there, it's easier to deal with because there's the warmth of someone else sitting next to you. So I think just less individualism. Just because a youth can doesn't mean a youth should when it comes to, like, overworking themselves. The biggest thing is I did it to myself a little bit. I would always say, I'm okay, I can keep going. Don't fucking listen to a youth when they say that. They don't necessarily know, like, not to undermine their capacity or anything, just I wasn't aware of the volume of trauma that I would be facing. So, yeah, transparency and stopping them if they can't stop themselves. Does anyone else have anything to say?
I'll say that funding entities should be aware about all the work that is done by young people, and they should make funding accessible for them. Being a registered organization in many countries, especially, in Latin America, is very expensive. So sometimes I think funding should be available and accessible for young people so they don't suffer these consequences. And also, not just funding, support them. There are many people that have a long path in advocacy, and they can bring a lot of their experiences to young people so young people can take what's best for them.
I would also add having cultural competency, cultural humility. I think you were the one who said that we can't generalize youth, and we all come from different backgrounds, and what causes us stress is not just the work that we do, but what happened before we got to the job. There's political stressors, right? There's economic barriers, there's racial barriers, there's gender barriers that we come and then we go and show up to this work, and then we have to put ourselves to the side and focus on the person that's there. So we need a lot of support for the folks that we're helping, but as well as someone to check in on you. Are you okay? And how can we support you that is reflective of your individual needs collectively, right? But at the same time, what is it that you need personally, whether that's more queer and trans support, whether that's more racial identification support, right? If you need a group that's para Chicanos or Black women, right? Trying to have that support is super important, and providing cultural humility, as well as helping young people and adults deconstruct their own implicit biases that we have when we do this work. So that's one of my suggestions.
Hi, I'm originally from Theresa. I'm originally from Cape Town, South Africa, but I'm also in Canada now for the last 33 years. And I just want to commend all of you. Really, really excellent work. But more to you, Jade, for the work that you are doing. But the pieces that you really pointed out that is absolutely so vital, that whole notion about youth. I was, for about 9 years, manager for youth program in Toronto for African, Canadian, and Caribbean youth. And I have to tell you, when I started there, that whole notion about youth goes up till 29. And absolutely, I agree with you. So I had youth from 13 to 29. Right? 13, they were already in the criminal justice system, et cetera, et cetera, et cetera. The first pieces is what was missing. And those black youth said, our voices, we are not heard. So we looked at stuff, how can we help youth find their voices? And you talked a lot about that. You talked a lot about the whole notion of helping youth find their voices is really the key. And what I have learned as an adult at that time is that they have so much to give and so much to offer with the right support. And so we created a PAC, a youth advisory group, and they started leading that organization. We were really secondary. But the key pieces that emerged from the youth is that whole notion of cross-pollination, and you all talked about that. But us joining hands, going into different youth organizations, talking together, taking the youth to those organizations. And one of the biggest things that emerged that really didn't come up is the fact that a lot of the youth, as I said, they were 13 to 29. Many of them wanted their parents to be involved because it was a missing piece, right? If they were were thrown out of their house. I asked the youth, what can we do about that we have excluded, the parents? How do you want to do that? We started groups where the parents were one side, the youth were the other side. And it was very organic how they ultimately got together. So not to exclude that part. And then the final piece that all of you talked about is the whole notion of education, education, education. Sometimes we just underestimate the fact that, people don't know, they don't know, but that is really the danger. So I just wanted, and finally, thank you for bringing up, I'm a trauma therapist. I mainly work with Indigenous populations right now in Canada. And that aspect of the storytelling is so vital and so absolutely important. And finally, as a trauma therapist, I'm also, that whole notion of vicarious traumatization and burnout. And that was another discussion that I had with the youth, not just for the youth, but for us as well, and the staff that work with me. Because the youth didn't want to come to organizations. My staff had to go out to meet wherever the youth wanted to meet, whether it was at McDonald's, whether it was at a park or whatever. But that whole notion of burnout. So for that as well, we have to be aware of that and do the health stuff that work. And you know what that youth came up with? Because I'm also a yoga and mindful. Well, teach us yoga. So we all did yoga together and really getting into our embodiments and working through releasing and discharging trauma and stuff that we carry. But that whole notion of being together, joining hands together, connecting with other organizations is so vital and so important because, yes, at the end of the day, we work with the most difficult population, working in harm reduction. And yes, we do burn out, we're human. But we can support each other, love one another. And if we need to take time out, we can take time out. That's okay, too. So thank you very, very much, everyone.
So my name's Damon Barrett. I work with Russell at the University of Gothenburg. I've been coming to a lot of these conferences, and it took a long time for there to be youth panels. I think this is the best one I've seen because it's the most comprehensive and it's the most in-depth and detailed. I have a question that anyone could respond to. I think mostly maybe Jade and Juanita, because I've kind of specific versions on a theme, which is it's still the case that harm reduction can be seen as controversial to some. And if you add particularly young people into that question, I can only imagine it being magnified. So I don't know, Juanita, if you were involved in the recruitment of the schools, but I'd be really interested to learn how you got the school authorities to agree to a harm reduction oriented curriculum. Because where we're from in Sweden, I just can't imagine it. And I don't know. So any techniques. And then for Jade, I just had despite the fact that you guys were saving lives, did you get any pushback from anyone in the community about what you guys were trying to do?
So to answer your first question, a lot of the times people who are attracted to harm reduction or safety first already knew about DPA. So they were coming from there and coming to Stanford. But then as we got more recognition, there's more schools. And so we put in our trainings about how to talk to your school district or school administrators about getting them on board to harm reduction. So we highly encourage show data, show the data that it works. We understand that just saying no does not work, and we need to show how does that impact young people. We also understand that young people will try and use drugs. So even though that a lot of teachers or educators or parents do not like the idea or cannot accept the idea of harm reduction, but recognizing that you are causing more harm by not educating them. And so we have to center that and center the child or center the young person. And so we create person-centered drug education. So for me, it's kind of like you come knowingly that you want to do this work, but we also offer support of advocating and educating other adults who may not be in full support of harm reduction. But I also think it's about creating spaces for adults, like you said, about having parent buy-in and talking about our implicit biases that we have about substance use and destigmatizing substance use, as well as working with our own internal struggles as adults of using substances and raising and working with young people. So I'll impart that there, and I'll pass it to you, Jade.
I don't know if you can do youth harm reduction work without pushback. We got tons. The population that I worked with primarily was probably 90% Indigenous, and a lot of them didn't have their parents involved. So that's a lot of the reason we were able to do the harm reduction work that we could. However, I think this lady here, she had an excellent suggestion about the parent-youth meeting. I think that's a very good way to get the community involved. Invite them, bring them in. Like, they're a part of it too. Because they might be ignorant too, not like intentionally, but it's not willful or anything. It's just they need education too. They were youth too, and they didn't get it then.
So we have one last question, and we have 3 minutes, just so everyone knows, just to make sure everyone has time for lunch.
Thank you very much. I have just a comment for Jade. Jade, I'm Bushra from Pakistan. We are working with female sex workers and implementing HIV and AIDS prevention programs for them. Thank you very much for sharing your story and bringing forward the forgotten parts of the lives of children, of people who are using drugs, and also of the female sex workers. And it was an enlightening session for me to attend your especially presentation. Storytelling is such a great tool for healing that we have also been practicing since 2019 with female sex workers, where children of female sex workers have told their stories, where sex workers themselves have told their stories, where parents of sex workers have told their stories. And that was healing for not only for them, but also for others who were participating in the groups. We call it the Shame Izhar, that is in Urdu, which means an evening of expression. And that is a really powerful tool for us to bring people together in a conservative society like Pakistan. And I'm very appreciative of how beautifully you have managed to deal with your traumas and how you have come forward and you have been able to work not only on yourself but also with others. That's a great thing. And I appreciate that a lot. And what I've learned from you is that we need to do harm reduction with our youth. And in Pakistan, there is no such initiative. And I think we should do that in schools, in colleges. Going back, I would see how we could incorporate that, and I'll try to keep in touch with you. Thank you very much for sharing.
Thank you.
All right. we're probably at time, guys. I could have squeezed in one more maybe, but we're pretty much at the 15 minutes. So thank you so much for coming, everyone, for engaging with this incredible conversation. And thank you to HRI for progressing it. And yeah, let's make sure this stays on the agenda always. Yeah.